Safe and timely discharge of patients is a priority for the Trust, and patients receiving accurate TTOs is a key component of this. There have been a number of significant errors resulting from staff not adhering to policy and following best practice. This has resulted in poor patient experience, patient harm, patient complaint, and stress to other members of staff having to deal with these consequences. Medical errors often occur when patients move through the healthcare interface from primary to secondary to tertiary care. There is clear evidence for this. The main reason for this is inadequate or incorrect communication between organizations. It is therefore essential that the TTO is an accurate reflection of what the patient should be taking on discharge and that the information is clear for the GP.
Patients will sometimes cite their discharge experience as being a poor or suboptimal experience. A lot of this discontent is due to poor communication with the patient. The patient may have little understanding of the process of preparing their TTO. Nursing staff on the ward should help the patient's understanding of the process. This can be done by giving patients a realistic time that the TTO is likely to be ready. Simply saying to a patient at 9 AM, "We are just waiting for your tablets," sets an immediate expectation for the patient that their TTO will be with them imminently. Routinely, there could be a delay because the TTO has yet to be written, the patient requires a blister pack, INR testing for warfarin, or there are prescriber errors that need to be rectified. It is better to inform the patient of what needs to happen first with their particular TTO so they understand what is going on in the background. The pharmacy department has developed a tracker system to enable the staff on the wards to give patients live up-to-date information on the progress of their TTO. The TTO tracker will be explained later in this video. Following the process outlined in this video will ensure a safe and improved TTO process. It can be split up into 3 main steps. The first step is the writing of the TTO. The second step is the verifying and dispensing of the TTO. And thirdly is the checking the TTO on the ward and performing teach-back.
The prescriber will create a discharge summary document. This contains all relevant clinical information. References to medication in the summary must reflect what is on the TTO. Please be mindful of this when changes are made to the medication. Either the prescriber or a pharmacist present on the ward round will write the drugs needed for the TTO. Drugs written for discharge have an icon next to them.
This is done in pharmacy and includes the processing of the TTO. This is ensuring the correct inpatient drugs are transferred to the TTO. Dealing with any delays or problems, for example antibiotics not having a course length or drugs incorrectly missed off the TTO. Drugs provided with the TTO comprise of one or more of on-ward drugs. These are drugs labelled up as inpatient. Patient's own drugs. These are medicines brought in by the patient. New drugs. These are the drugs dispensed at the point of discharge.
Once pharmacy have been informed of a TTO, it is added to the TTO tracker. With the time here, you can see it's been received in pharmacy, the name of the patient, and the priority, with green being standard priority and red urgent, ring when ready, typically turned around within 1 hour. And you can see here the location of the TTO. You will only be able to see patients on your ward. Any reason for delay in the discharge, you will see underneath the patient name. So here you can see there is a prescriber query note for this patient. Underneath this one you can see there is a delay waiting for warfarin bloods to come back and warfarin dosing. Once the queries are resolved, the pharmacist can clinically check the discharge prescription, and once that is completed you will see the time in this column here. That means it is now being put through for processing. In these other columns here you can see other bits of information, for example controlled drug prescription and whether we've received it, warfarin as I alluded to before, and whether the patient is to have a blister pack. All these bits of information can be relayed back to the patient to inform them of their progress of their TTO and likely discharge time. Once the prescription has been dispensed, and you can see the number of items that are going to be dispensed for each prescription. Once they've been dispensed, they are clinically checked. And once they're clinically checked, you will see the time here entered on the right hand side. For patients going to the discharge lounge, it is absolutely imperative that the clinical check takes place before the patient is transferred to the discharge lounge. Once the TTO has been completed, you'll see by the time stamp here in this column, the TTO will be placed in the pigeonhole for the respective ward, ready for the next pharmacy bag run. If nursing staff wish to collect the TTO before the bag run leaves, then that is absolutely fine. Just simply check that the TTO has indeed been completed.
To ensure a TTO has been verified by a pharmacist, please ensure the "not verified by pharmacist" words are not written in red letters at the top of the discharge summary document.
When the TTO arrives on the ward, all labelled drugs for the patient should be collected from patient medication lockers, the CD cupboard, together with any drugs sent up with the copy of the TTO. The nurse discharging the patient then needs to check that the TTO copy has been verified by a pharmacist. It will state at the top if it hasn't. Next, the copy of the TTO needs to be compared to the on-screen inpatient medication. This is very important to ensure any last-minute changes by a prescriber have not been missed. Any queries should be directed to the prescriber or pharmacy. Next, check the drugs line by line. Doses and strengths of drugs are often changed and some drugs get discontinued. The strength and directions of the drug should be checked against what is written on the paper TTO copy. Any drugs present that are not written on the TTO or differ in strength or direction should be returned to pharmacy in the green bin, unless you feel that there has been a mistake and the prescriber or pharmacy need to be informed. Once you are sure that the TTO is correct, you then need to follow the discharge algorithm, which includes the teach-back process.
For nursing staff to print off the most recent copy of the discharge summary, select the patient on your list, go into Print Reports, select Pharmacy Reports, Discharge Summary, and then Preview, and then Print.
Have you taken this one before?
No, I don't think so.
Okay, so this is atorvastatin, and this one's for your cholesterol.
Okay.
And we want you to take one tablet at night.
Okay.
Have you taken this one before, Ramipril?
No, I think that's new as well.
Okay, so this one's for your blood pressure, okay, and this one you're going to take one capsule twice a day.
Okay. As well as the patient information leaflets supplied inside the medication boxes, pharmacy supply a simplified version for common heart medicines. Please use these leaflets to signpost patients to the most common side effects of their new medicines.
Okay, so just so I know that I've explained it properly, could you just tell me what atorvastatin's for?
Yeah, that's the one for my cholesterol, which I take once at night.
Great. And Ramipril?
Is that the one for my heart rate?
This one's actually for your blood pressure,
Oh, okay.
and this one was the one you were taking twice a day.
Oh, okay.
Okay. So do you have any other medications, inhalers, eye drops that we've missed off from here?
No, I think that's everything.
Okay. So if you have any questions about your medicines when you go home, okay, just ring the number on here and ask for pharmacy,
Okay.
or you could ask your GP as well. Okay. Here's a copy of your prescription. We've given you a supply for now. Any further prescriptions you need to get from your GP.